Hi, my name is Umit Agus. I'm the Chief Executive of Far West Local Health District. Thank you for taking the time to get to know our organisation and our people. Here at the Far West, we have a clear mandate, and that is to provide the highest quality care and services to our communities using the latest clinical evidence and technological enablers. Our vision is to create excellence in rural and remote healthcare. Everything we do is underpinned by our core values of collaboration, openness, respect and empowerment. Key to our success, of course, is our people. Our workforce is inclusive and diverse. We employ well over 800 clinicians and support staff and visiting specialists from around Australia. We are, in fact, one of the largest employers in our region. Our staff are connected to their communities, which drives us to go the extra mile in providing a high quality service.
One of our highest priorities is to deliver patient-centred care. We train all our staff so that we have the right staff delivering the right care at the right time, from the porters to the cleaners to the nurses to the doctors. It's our core business to keep patients safe, and when they're transferred home, that they have the appropriate referrals and they're looked after in their own home.
We are the second largest LHD by geography. We cover some 200,000 square kilometres. Our population is just over 30,000 and are serviced by 9 facilities. 6 public health facilities, 2 multi-purpose services and a primary health care centre. The iconic, nationally heritage-listed town of Broken Hill makes up our central hub and is home to the largest hospital in the region.
If you're travelling out to Broken Hill, it might seem a long way, but when you get here, you realise it's an oasis in the outback. It's a place that's friendly, it's a place that as you walk down the street, people say hello, and it's a place that when people come, they want to stay.
It's a very different lifestyle. It takes me 5 minutes to get to work instead of 60 minutes. And I feel like the community, I just moved out here, you'd walk down the street, people would actually say hello, and I was like, are you talking to me? Like, whilst you just don't get that in the major cities, so you actually feel like you're a part of a community.
One of the big things for me is that real sense of community. There's a real sense that you really belong to the community that we serve.
As soon as I came in here, I really got lost on my way coming to the hospital. But there was this lady I just happened to ask about directions. She never hesitated at all, accompanied me all the way from where I met her down to here in the hospital. So I was like, wow, this is different, really different. This is the place for me.
We rely heavily on the health service and we value all the staff that work for it and make sure that for us as community members that we are taken care of and our health is a priority.
The advantage of a small community such as Broken Hill is that we really can help the community and meet their needs. We're able to kind of have a much closer relationship with patients. Once they're discharged, we have the time to be able to ring them, offer reassurance, make sure they're okay.
My name is Kim, and I was an inpatient at the Broken Hill Hospital for approximately 11 weeks, and all of the staff were just absolutely magnificent. They were very, very friendly and nothing was ever too much trouble. They were always there, they were very caring, very kind and very, very respectful to my needs, and they are the ones that have got me back on my feet. And to everybody I say a very big thank you.
Outside of Broken Hill, our 8 district health facilities are based in Balranald, Dayton, Ivanhoe, Menindee, Timberburra, Wentworth, White Cliffs and Wilcannia.
In most of our facilities, we're working in a small community, anything from a 100-person town up to about a 1,600-person town. So you really connect with the community, you get to understand the needs in the community and work closely with community members to help them manage their health and their family's health, short-term and long-term.
Working in a small community is fantastic because The community knows you, you know the community, they feel comfortable with you, and you give better care, I think, if you know the person personally.
You get to know them on a different level. It's not just a face through the door.
Our commitment to our community is unwavering, in that we want to provide the best possible care.
I grew up in the bush, so I understand how tough it is when you're in isolation and there's not a lot of services, and it gives me a great sense of pride in being able to assist people in their everyday lives, make a difference in their everyday lives.
Far West really is a unique place to live and work. From the spectacular red desert landscapes of the Aussie outback on the one hand, to the lush greenery of our lower western sector.
Here in the Far West, we have one of the largest Aboriginal populations in New South Wales. 13% of our community members are Aboriginal. So in the Far West Local Health District, we are doing a number of things to ensure that we are caring for the health needs and the cultural needs of our community members.
Planning for here and now and for the future needs of our communities is at the heart of our regional strategy. We cannot do the work that we do without our key partnerships. We work very closely with our service partners such as the Royal Flying Doctor Service, Aboriginal Health Services of Marama and Kumila Health, Primary Health Network and various NGOs scattered throughout the region. Here in Far West, we work together to make a real difference to the lives of our communities. We are committed to doing everything that we can to achieving better health outcomes for our communities and in partnership with our communities. Our togetherness is our strength.